Welcome to another video of Health Facts with Dr.Danesh. In this video, we're going to assess the effects of anabolic steroids on human body. Anabolic steroid abuse in athletes has been associated with a wide range of adverse conditions, including hypogonadism, which means low or absent hormone secretions from gonads, including testes and ovaries, or testicular atrophy, which means smaller testes, which is not functional, impaired spermatogenesis, which means lower production of sperms, gynecomastia, which means the bigger size of the breast in male, and psychiatric disturbances, which means the mental disorders. But what effect does steroid abuse have on the cardiovascular system? That's what we're going to find out here. Anabolic androgenic steroids such as oxandrolone and decagerabline and equipoise are widely abused for enhancing muscle mass, strength, growth, and improving athletic performance. In this article that published in 2012, they assessed the adverse cardiovascular effects of anabolic steroids, and they showed the pathophysiology imaging. So they've done extensive research to find out the adverse effect of anabolic steroids on healthy individuals who are willing to enhance muscle mass and strength and growth. The term anabolic androgenic steroids refers to a group of compounds that are structurally related to testosterone and exert two main physiological effects, including muscle growth and masculinization. Since 1940s, AAS, which is anabolic androgenic steroids therapy, has been advocated as substitution therapy of testosterone deficiency and hypogonadism, which we talked about. Moreover, AAS in high doses has been abused with the purpose to enhance muscle mass and improve athletic performance. AAS administration has been shown to be associated with cardiovascular side effects, urogenital problem, that is gynecomastia, impotency, which means low sex drive, hepatotoxicity, which means toxicity for liver, hepatocellular carcinoma, which means the cancer of the liver, and neuropsychiatric disorder, which means mental disorder as mentioned before, that is aggressiveness and depression. Cardiovascular adverse effects of AAS abuse have been reported sporadically as case reports of hypertension, myocardial infarction, and stroke, dysrhythmia, cardiomyopathy, and sudden cardiac death. So in 2012, next to relevant clinical indications of AAS, which is an anabolic androgenic steroid, in physiological doses, which is 28 to 56 milligram per week, illegal abuse of high doses of AAS as a muscle strengthening agent in eugonadal men, which means men who have no issue with the producing or secreting the testosterone from their testicles, is reported in high rates, which results in blood levels of androgenic compounds 10 to 100 times above the physiologic and therapeutic range. So what are these adverse effects of anabolic steroids on heart and vessel system, which is cardiovascular system? Metabolic and vascular effects of anabolic androgenic steroids. Lipid profile alteration and early atherogenesis, which means plaques in our vascular system or vessels that increase the chance of stroke. Therapeutic use of AAS has been shown in many studies to affect the individual's lipid profile. A meta-analysis, which is a highly reliable study, including 19 studies and comprising 272 hypogonadal men, which means men who are not producing or secreting enough testosterone from their testicles, showed that substitution therapy with intramuscular administered testosterone results in a decrease in plasma HDL, which is high density lipoprotein cholesterol level, which means a good cholesterol. So they decrease the good cholesterol, which is HDL, in our lipid profile. The same results were also demonstrated in a recent meta-analysis, including 51 studies, recent meaning the 2012, on men with low to normal plasma testosterone levels who received testosterone in different doses as therapy. The second mechanism that anabolic androgenic steroids affects our cardiovascular system is increasing the adhesion molecules expression and platelet aggregation, which basically means that actually they are increasing the adhesion of platelets, which basically increase the chance of blood clotting. Another impact of anabolic androgenic steroids are impaired vasodilation. Although endogenous testosterone has been shown to exert vasodilatory effects, which means opening up the vessels, AAS, on the other hand, used in hypogonadal men, has been shown to result in paradoxical pro-atherogenic, which increase the blood clotting, vasoconstrictive effects, which means narrowing down the vessels. In a study on male bodybuilders who abused AAS for 3 to 4 years, vasodilation was significantly lower than that of ex-abusers and controls. In summary, metabolic and vascular adverse effects of AAS abuse can be classified as: number 1, alteration in the lipid profile, especially decreased serum HDL levels, contributing to endothelial damage. Number 2, increased platelets adhesions to vascular wall. Number 3, vasospastic effects and impaired vasodilation, which basically means that our vessels are not able to open up properly. This is a case of 40-year-old male bodybuilder with mild abdominal aortic atherosclerosis on CT. So atherosclerosis is the precursor for myocardial infarction. And actually in this picture, as you can see, this is the arrow. This arrow is actually showing that there is an inferolateral infarction owing to acute right coronary artery occlusion, which is caused by AAS, which is anabolic androgenic steroids. However, up until 2012, we didn't have a proper randomized controlled trial or any studies that we could actually rely on until this study that is published in the American Heart Association Journal Circulation. And this study actually looked at the effects of long-term steroid use on the heart. So anabolic steroids are synthetic substances derived from the male hormone testosterone that increase muscle size and strength. In this study, they actually studied on 140 male weightlifters. This study published in July 7, 2017. It is interesting that they actually estimated 2.9 to 4 million Americans that have taken steroids without a prescription to boost athletic performance or appearance. In this study, the longer men reported taking steroids, the worse their arteries were. Plaque buildup is a sign of heart disease, which is the #1 killer of men and women in the United States. This is the first study of its kind to demonstrate the negative effects of long-term steroid use on the heart. In this study that conducted at Massachusetts General Hospital, researchers used imaging tests to compare the heart function of steroid users versus non-users. The study included 140 male, as mentioned before, weightlifters between 34 and 54 years of age. Among participants, 86 reported using anabolic steroids for at least 2 years, while 54 reported never using steroids. After analyzing test results, researchers found that steroids users had significantly weaker hearts than those who never used steroids. Among steroid users, men that currently use anabolic steroids had significantly worse heart function than past users. So in this study, it is obvious that weightlifters who are taking anabolic steroids have a direct negative effect on their vessels and heart. In this recent study published in 31st of August 2019, published in publication European Society of Cardiology, they concluded anabolic androgenic steroids use is associated with decreased heart function in weightlifters. The study authors recruited 100 male weightlifters, 58 with more than a year of cumulative AAS, which is anabolic androgenic steroid use, and 42 who do not use steroids, with no difference in age or BMI between the two groups. So 42 patients or 42 people are the control group here. The size, thickness, mass, and function of the heart were measured with echocardiography, which uses sound waves to monitor heart and valve function, and ejection fraction, which measures how much blood the left ventricle pumps out with each contraction. They found AAS using weightlifters had a thicker heart muscle, on average a 2 mm thicker intraventricular septum, which is the wall separating the lower chambers of the heart. The left ventricular posterior wall was also on average 1.2 mm thicker in the steroid group. The steroid group also showed reduced ability to contract the ventricular chambers of the heart during a cardiac cycle. Both ejection fraction and ventricular global strain, a new method to assess systolic function, were decreased in AAS exposed weightlifters as compared to non-steroid group 49 versus 53% on average, and minus 15.6% versus minus 18.3%. There are many case studies out there on AAS using weightlifters who end up dead or hospitalized from a heart attack or life-threatening cardiac arrhythmias. Evidence-based recommendations for natural bodybuilding and how to maximize the muscle bulk all over the body and how to have the proper muscle growth. I hope you enjoyed this video, and if you like this video, please share and subscribe to the channel for more video to come. And as always, stay happy and healthy. Thanks and have a great day.